you so much. I'm so excited to be here with all of you this evening. Like Tom mentioned, my name is Caitlin Whitlock. I'm an acute care and intensive care unit physical therapist, and I work at Emory University Hospital in Atlanta, Georgia. And I also did, after completing my doctor of physical therapy at Emory, I completed the Emory acute care residency, where following that, I also sat for and was passed my cardiovascular and pulmonary certified clinical specialist exam. So that's my specialty area. And I currently work primarily in the cardiovascular and pulmonary intensive care, surgical intensive care unit, and work with patients on various types of mechanical circulatory support. But over the last few years of my career, I've worked in every intensive care unit that our hospital offers, including the neurologic ICU, the medical and surgical ICU with kidney, liver transplant, pulmonary patients, and was also the primary COVID ICU physical therapist during the peak of the COVID pandemic. So the goal for me for this lecture and time with you all this evening is to share a bit about what I've learned over the last 2 years, especially as our medical technology advances, and how to improve practitioners' confidence when working with complex patients. And now that complexity doesn't necessarily just mean that they're on significant or complicated mechanical circulatory support or have significant number of invasive lines or tubes. It can also just mean complex in a presentation standpoint. So hopefully all of you can take something away from this evening, no matter what service area or specialty area you practice in. But that's enough about me. What we will be talking about this evening is on the slide in front of you. We're going to start with just some general introduction type things, some themes for the evening. Then we'll get right into acute care and ICU safety and feasibility, sort of the baseline of what we all do, right? Is it safe and is it practical to perform? Then moving into lines, tubes, and monitors, and some of the different things that I see and work with in the intensive care unit, but also on the step-down units or floors of the hospital. Then we'll talk a little bit more about early mobility and the physiological response to exercise in critically ill patients, and how to consider that across the spectrum of the continuum of care for all patients, specifically thinking about what patients are going through in the ICU and how they may present down the road. I have an interesting case to present for you, and then we'll talk about some creative treatment approaches within that case. And my goal is to save plenty of time for questions at the end. So with that in mind, let's get started. And the objectives.